is 8:18. You're watching BT Vancouver. Thanks for joining us on this Thursday. Well, after months of frustration over testing shortages and delays, a new saliva test could be on the horizon. Joining us now is Dr. Srinivas Murthy from UBC. Good morning. Thanks for joining us.
Good morning, Mary.
So for those who haven't been tested for COVID-19, tell us the difference between what the testing looks like now compared to this new saliva test.
Sure. And so right now, it's a swab that goes into your nose, sort of scrapes the back of your throat for a few seconds, and then gets pulled out. That test then gets sent to a lab where they give you the results within, hopefully, 24 to 48 hours. There are new tests coming down the pipeline. Some of them are approved in different countries already, where they get saliva instead of that back of the throat swab. And saliva is our spit, and so it's much more easily accessible and less discomforting for smaller people and children especially.
And less invasive and painful, I imagine. I've also been hearing these new tests, they're much cheaper, and we could get results much faster.
Sure, and so there are two ways of doing saliva tests. There's still the same way where we get the saliva, send that off to the lab, and get results back within 24 to 48 hours. And that's likely to be approved in the next sort of near future. What's the next step above that is a saliva test that's rapidly available. Namely, you get a saliva and at home, like a pregnancy test, basically. It'll tell you if it's positive or negative within the matter of a few minutes. And these home-based tests, whereby you can more sort of rapidly assess whether you are positive or negative, yet in terms of production or availability around the world, but they're getting some science behind them to show that they're reasonably accurate. Not as accurate as the lab-based tests, but maybe accurate enough for public health overall.
It is fascinating to see how far we have come since March. Now, I wanted to talk to you about this. I have a cousin who recently started university in Missouri. He's 18, so he just moved into the dorms, and they tested everyone, all the first-year university students, before they moved into the dorms for COVID-19, and he got his results within 15 minutes. Now, I know we have a quick turnaround here in BC. We get our results within 24 to 48 hours, but is there ever a chance we could get our results, really, really quickly? And how soon can that come here to Canada?
Sure, and so that's more close to the quick, rapid tests that I'm speaking about. The problem with some of those tests is that if there is a low level of transmission, and so if you're not very likely to have the disease, the likelihood of it being falsely positive increases. And so in a place like Missouri, where there's a lot more disease circulating than a place like this, that has more value than a place like this, where it's going to be a rare diagnosis. That being said, it's important to have a range of testing capabilities available to us if, knock on wood, our case counts were to increase and we would need more active screening for something like that.
All right, and one more question for you, Dr. Murthy. With school just around the corner, students head back to school next week, university students and college students as well. Do you think we're ready for this?
I think it's obviously a challenging subject to answer in just a few seconds. I think we are, from a public health perspective, as ready as we can be in terms of testing capabilities, hospitalization capacity, and so on. The question of schools being ready in terms of protocols to make sure kids are as safe as they can be, I think are still being optimized, and hopefully I think we can get there within the next week or so.
All right, thank you so much for joining us this morning. Always great to have you on the program.
Take care, Mary.
All right, that is Dr. Srinivas Murthy. He is with UBC. We will post this interview online. We're going to take a break.